Hello, 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 hello. Good morning, good day, and good evening, wherever you are joining me on this video. This is the Kosh TV on YouTube, and my name is Janet. This channel is backed by a group of professionals who are very knowledgeable in their various field of profession. Okay, and the aim of the group is to improve the well-being of the community, especially the family. And we know the families make up the community. Okay, and I am a registered nurse with a few experiences under my belt. This video is a second part to the one I previously did on the receiving of the critically sick or ill patient into the resource department in A&E, ED, or ERs. Obviously, there will be some slight changes here and there, but it's usually not anything massive to throw the professional off should they find themselves in a particular EAD to perform their duties. Okay, so today's video is going to be just a brief catch up on the transfer or what leads to transfer of patients within the other units of the accident and emergency center to the resource unit or within the ED. Okay, so if you did see my previous video, please check it out. And if you're joining me for the first time, please remember to subscribe, share, comment, and like. Okay, so as I was saying, if you did see my previous video about receiving of patients into the resource unit in the accident and emergency center, I did give a brief overview or structure of how the A&E works in the United Kingdom. I mean, nationally, globally, okay. The healthcare system, there is just slight changes if you should move from one place or one nation to the other, right? But I know those of us in the developing countries are still trying to catch up when it comes to structuring our healthcare system. Okay, so this time it's going to be how we monitor the patient that has been brought into ED, accident and emergency center, and at that particular moment when they arrive, they seem not to need the resource unit because resource is for the very, very sick one who may need one-to-one monitoring or assessment and treatment, okay, before they are transferred to wherever they need to be transferred to. All right, but this time I'm going to center my attention on a patient that we may have received from the ambulance crew or who may have presented themselves into ED and provisional diagnosis and assessment may indicate that they do not need a resource center but can be cared for within either the majors, the minors department before and then being discharged, and then later things take a turn for the worse. Okay, this is where we are going to place our attention on today. Okay, so a patient has been brought in by the ambulance crew, has been triaged, information has been taken, or the patient may have presented them, so information has been taken, and the decision has been made that the patient stays within the unit. That's either usually in situations like this within the emergency majors unit of the emergency center. Okay. And then later things do not go so well as planned. Okay. Some of these patients may be patients who may have presented with some medical emergencies. Okay. There are some medical emergencies upon presentation do not really require that urgent and then a vigorous treatment. Okay. You usually maybe the decision has been made to give treatment as they present, and then later things take a turn for the worse. Let's say somebody comes in with a sudden onset of chest pain and they are acute coronary syndrome. Patient may have presented with difficulty in breathing. They're suspecting asthma or COPD. Okay, patient presented with abdominal pain, vomiting with probably observation not too worrying. The patient may have probably a previous history of a surgical procedure. All right, but at that particular moment that they have presented, observations and the presentation of the patient seem quite okay for them to be looked after within the majors or any other department aside the resource center. Okay. In situations like this, I'm talking to my fellow nurses, all right? If you have a patient in your care, the patient has presented with some of these conditions I have mentioned, or probably a little bit more. Could be hypotension. Sometimes we don't think hypertension could be a medical emergency, but some they are hypotension, hypertension, and DKA, honk, name them. And decision has been made to nest them within the A&E units aside the resource. The responsibility as the nurse. Every patient that presents to accident and emergency center needs to be closely monitored because anything can happen. You do not know. Yes, there are those. There are many occasions when they come in and assessment with treatment go as planned. But there are a few cases that we nurses who are in charge or charged with the responsibility to look after these patients need to be vigilant. A patient comes to you with, I'll go with a confusion, comes with you confusion. Let's say this is an elderly patient, confusing to be turning, very restless. Sometimes we can mistake confusion to be due to older like Alzheimer's or dementia that may have not been diagnosed. But confusion can be an onset of other medical conditions. We tend to forget that sometimes. Confusion, someone in severe pain, especially the elderly, could appear confused. An elderly, and I have actually seen my thoughts are getting distorted here. Let me tell you, I have actually seen younger person below the age of 40 presenting with confusion, and then they turn out to be UTI. Yeah, it may be rare, but it happens. Okay, so there are certain things. A UTI, can you imagine UTI undiagnosed and untreated for sometimes leads to sepsis. And we all know so much has been said about sepsis and the fact that the incidence of sepsis is going up and untreated can be very, very fatal. Okay, so when such patients come to you and a plan or you have made a plan to monitor these patients, please let's take our assessment seriously. Okay, our ABCDs very seriously. I've mentioned the S bar already in the previous video. So as you do your assessment, any variation, make note of it. The next time you do it, or if you're working with someone else, an HC, a healthcare assistant or a nursing assistant, a nurse associate, make sure they report to you any variances. Let them report to you any variances, any deviations. They should let you know and try to study the pattern. The patient comes to you, observations seem to be stable, but it hasn't improved. You've usually these are the situations when things can actually change. The patient has has come to you with an observation and it seems to be that way. It's not improving. Treatment has been given. All that has been requested by the doctor has been administered. And it seems to be just, if you look at your chart, just imagine, because we don't use those charts anymore. Well, I'm talking about the developed countries. It's horizontal. It's not going up. What you should know is that there are cases that this could just drop. It could just drop. Okay. So what you should be doing is keeping an eye on your observations. It's very important. Now, as you do this, you should report your findings or what you have noticed to your nurse in charge or the doctor in charge. Let them know that this is the trend you have observed and you're keeping an eye on it. Okay? Now, the second bit is when the patient seems to be deteriorating when you look at the observations that you have done and your assessment. You're keeping an eye on it. The doctor has been informed. The nurse in charge has been informed. So you're keeping an eye on these things. Okay. It doesn't seem you've done one, two, three. It doesn't. Let's take patient is perspiring so much. Antibiotics has been given. Everything on the chart has been given. You are maintaining a close eye, and the patient seem to be just perspiring. I mean, these are some of the signs of sepsis. Take the trouble and let resource department know that you've got a patient whom you are concerned about. Let them know that you've got a patient that you are concerned about. In some cases, the doctor might do so, or your nurse in charge may do that. But if that is not happening and you are worried, why not? Especially if you are within the same unit. Take the trouble, let them know that this is the situation. Because there are chances that when the doctor or your nurse in charge is free to come to you to assess the situation themselves for the patient to be transferred, there may not be space for the patient in resource. So when you take the trouble to let them know that this is what is happening, in most cases, it could be a nurse or experienced and other resource department. They may come and then see the patient themselves and tell you that okay, they will make a space available if you need them. So in a situation like this, you have thought ahead. Plans have been made. So if things should deteriorate further, a race against the clock, patient is transferred, and then patient receive the treatment that they need. In most cases, sometimes we do forget these things. Our line of communication. As I always say, effective communication can cut down our workload. If I haven't said it in plain language previously, I always mention the effectiveness of our communication. It can cut down the workload that we actually have to do. So it's important that if a patient is in your care, you monitor closely, especially those who come in with those medical emergencies. Yes, we are in emergencies, but we still have emergencies. Those who come in with medical emergencies, always keep a close eye on them. And there should be no circumstances that a patient comes to you with any respiratory problem and the patient isn't close to an oxygen outlet. That shouldn't be happening. Always make sure a patient that comes to you with respiratory problems is placed at an oxygen and medical outlet. Things happen. Sometimes we are swarmed with patients in such a way that we may not get all these equipment when you need them. But make plans. Always make plans. I know somebody will be thinking, oh, it's easier said than done. I have been in such situations. Two patients, let's take it, probably you are fortunate in this circumstance, I'll say fortunate, you're fortunate enough to have a department or ED majors department that has that open kind of opening plan, okay? So, and you're so swamped or you've got more than one patient with a respiratory problem. And because of that, you have only one outlet. Just place them close to each other. Use the screen. Use the screen, but place them close to each other so that if the other one isn't using it or doesn't need it urgently, and you think the other one needs it urgently, you can swap. I know. It's always not that easy, but we can always try. We can always try. Always make plans. Communicate with whoever you're working with. Be proactive in your actions. Think ahead, and the work would always be a little easier. Thank you so much. This ends my overview and monitoring of patients within the accident and emergency center. Questions, anything comes up later, I will come to you with the information. As I always say, remember, you and your community are responsible for your well-being. So make a positive impact wherever you are. So I come your way again. I say, stay healthy and bye-bye.